Okay. So टॉक्सोप्लाज्मोसिस, टॉक्सोप्लाज्मोसिस का नाम पहले सुना है? टॉक्सोप्लाज्मोसिस पैरासाइटोलॉजी में तो पढ़ा होगा आप लोगों ने। टॉक्सोप्लाज्मोसिस नाम से क्या लग रहा है? इट इज कॉज्ड बाय पैरासाइट, अ प्लाज्मोडियम पैरासाइट।
Toxoplasma gondii.
Yes, it's caused by the Toxoplasma gondii. So it is a coccidian parasite and it belongs to the phylum Epicomplexa. So this disease, toxoplasmosis, can be categorized in the different type of zoonosis. For example, it can be categorized under the direct anthropozoonosis, because here the definitive host cat, definitive host of the disease is the cat. That is considered as the complete host. Complete host means it doesn't require the intermediate host for the completion of life cycle, but accidentally other animals like more than 20 mammalian species or small like small rodents, including man or sheep and cattle, goat, they are involved in the life cycle, but they doesn't require for the completion of life cycle, but sometimes they involve accidentally. So this is known as the direct anthropogenosis, and that also can categorize under the facultative cyclogenosis. Cyclogenosis means it requires more than 2 vertebrate hosts for the completion of life cycle. So it is just like the facultative, the intermediate host, other mammalian species like other different animals, pigs, sheep, or human being can be involved in the life cycle. That's why it is come under the facultative cyclogenosis. Third one is the saprogenosis. Saprogenosis means it can be infected. The human can be infected through the ingestion of the contaminated food, contaminated water. So it is also considered as the saprogenosis, and definitely it can be transmit to the human being through the infected food or infected meat. So it is under the foodborne zoonosis. So these are the different classification in which you can categorize the toxoplasmosis. Okay. So as we know, the positive agent is Toxoplasma gondii, and this is the obligatory intracellular parasite. This is a epicomplexan type of parasite because of the structure of this parasite. This is under the Epicomplexa, phylum Epicomplexa. So the name of the parasite, gondii, is actually based on the North American rodent. It is not based on some scientists. It is based on the intermediate host rodent, that is North American rodent. Specifically, it is known as the gondii. So its name is based on the rodent. Second one, when you see the history, it was first isolated by the Napoleon Mansioux in 1908, and later on, the congenital efficacy of an infection of the disease was discovered in 1923, and a very specific test or a specific or sensitivity test that is known as the Sabin-Feldman dye test was discovered in 1948, and life cycle in definitive host was discovered in 1969. So these are the some little bit history of the Toxoplasma gondii, okay, or you can say the Toxoplasmosis. So as I discussed that the cat is the definitive host, and you can also consider a cat as the complete host. Similarly, along with the cat, other wild felids or felines are also a definitive host. Other than cats or non-feline animals like goat, sheep, cattle, pigs, they are considered as the intermediate host, including human. Human also act as an intermediate host, but does not require for the completion of life cycle. Means not human or not other animal species is not required for the completion of life cycle, but accidentally they may involve by getting the infective stage. So they are considered as the intermediate host, but does not require. Cats itself sufficient for the completion of the life cycle of this parasite. So cat is a complete host, or main host is there. So it is definitely host, definitely, but it is also a complete host. So here you will see the infective stage. These are the infective stage by which anyone can get the infection. Is the we'll discuss later the different stages of this parasite. So first is the oocyst. Oocyst is excreted through the feces of the definitive host, cat. Okay, and human can get the infection by directly consumption of the oocyst through the infected vegetation, or can get the infection by the consumption of tissue cyst, which is present in the muscles of the food animal like sheep or pigs. So we'll discuss later the cycle of the parasite, and definitely here you see, here you see the, this is how the infection is transmitted. So cat here act as a definitive host or complete host. So whenever the cat ingests the small rodent, okay, small rodent which consists the tissue cyst, they consume the cyst, and in the intestine of the cat, it penetrates the intestinal wall, and this tissue cyst consists the bradyzoids that multiply rapidly in the cat intestine by the asexual reproduction, that is known as the merogony, and fast replicate in several generations, and multiple times it become it replicate. So this is the asexual reproduction. After that, several times or several generation, they multiply by the gametogony and forms the two male and female gametes, and ultimately it forms the oocyst. That oocyst is unsporulated. That unsporulated oocyst is evacuated through the feces of the cat. So that is the infective stage for the different animals, or also for the human being. So ultimate is the tissue, fecal oocyst of the cat is the infective stage. So here you can see it may be present in the cat litter in the domestic cat, or if this oocyst is present outside, then it can also contaminate the vegetation. Okay, and this vegetation either can be taken by the human being or by the herbivorous animals, by which this tissue cyst, actually cyst was unsporulated in the feces. After that, it comes in the environment and it becomes the sporulated oocyst, and that sporulated oocyst is the infective stage. This is the cycle actually. Here, the first step is the fecal oocyst, and which is excreted in the environment, and either by the contact or a hygienic condition, the human being can get the infection, or through the vegetation, or through the vegetation also it can transmit to the animals, herbivorous animals, and through the herbivorous animals, human can get the tissue cyst. So by which the infection is transmitted. This is the transmission cycle of the disease, and the most important is that if the woman is pregnant, then the tissue cyst or the tracheozoids, infective stage is tracheozoid, that can penetrate the placenta, and it can penetrate the placenta and enter into the fetus, and it causes the abortion or different types of complication after the birth. So it can transmit the transplacentally. So this is very important. So every time it is written that the pregnant woman should take care during the handling of the cat litter. Okay, so this is the transmission cycle of what is tracheozoid actually. First, whenever human being can get the infection, or any of the intermediate host can get the sporulated oocyst, and through the food or by any means, it penetrates the intestinal epithelium, and it rapidly multiply. Rapidly multiplying stage is known as the tracheoids. Tracheoids is fast replicating stage. And after that, if the immune system sensitized, then it forms the tissue or tissue cyst and becomes and convert into the bradyzoids. Bradyzoids is the slow replicating stage, and both are banana shaped. So these are the stages which is present inside the intermediate host. Tracheoids is the fast replicating stage, and later on to hide from the immune system of the intermediate host, they form the tissue and convert into the bradyzoid. So this tracheoid may also penetrate the placenta and infect the fetus, developing fetus. So this is the transmission cycle, how infection is transmitted. इसमें कोई problem है? If you have any doubt, you can ask in any of this step. How it is transmitted, which one is the infective stage for the human being, or what are the stages which is present in the intermediate host. किसी को doubt है इसमें? थोड़ा speedy हो रहा है इसलिए पूछ रही हूँ. कोई doubt है तो बताओ.
मैम मैम ह्यूमन में सिस्ट के बाद उसका जो रेप्लिकेशन है मल्टीप्लिकेशन स्टेज वो नहीं समझा.
After the ingestion of the sporulated oocyst, human being or any of the intermediate host can be infected by the sporulated oocyst. Okay, after the ingestion, it enter into the intestine and it penetrate the intestinal wall or epithelium and multiply rapidly. That is known as the tracheoid, rapidly multiplying stage, tracheoid. But after that multiplication, what happens? Immune system becomes sensitized. Immune system, जो भी intermediate host होगा, either it may be human being or animals. तो immune system activate हो जाता है. तो उससे hide होने के लिए वो slow replicating stage bradyzoid में convert हो जाता है और अपने चारों तरफ एक tissue cyst बना लेता है. Either in muscles or sometime it moves to the eyes or brain or different visceral organ in the intermediate host. तो वहां पे वो रहता है in the form of tissue cyst. ये है, दो ही stages हैं, bradyzoid, tracheoid and bradyzoid. Bradyzoid is the slow replicating stage or resting form or tissue cyst, which is somewhat stationary phase, you can say, and tracheoid is the fast replicating stage. तो ये दो ही stage बनते हैं in the intermediate host, either in the human being or in the animals. Here also you see cat excrete the fecal oocyst. It becomes sporulated. It contains sporozoid, which is taken by the small rodents, small mammals like rodents or birds. And this tissue cyst is again taken by the cats. This is the normal cycle. But sometimes this fecal tissue cyst is taken by the intermediate host, or sometimes through the food to the human being, and also human being can be infected with the tissue cyst of the food animal. So this is the another cycle of the toxoplasmosis or in the intermediate host, you can say. Or this is the natural cycle which is carried on between the cat and the small rodents. So this is the life cycle of the Toxoplasma gondii. So clinical sign, the incubation period is vary between the means how human can get the infection. If the human can get the infection through the contaminated food or water, then the incubation period is more, that is 10 to 23 days. This is based on the observation. And if the human being can be infected with the contact with the infected cat, means handling of the cat litter. In such cases, the incubation period is 5 to 20 days. It varies, and this all is based on the observation. Okay, so later on, after that, you can say in 20 days of incubation period, it will show some symptoms. So most of the cases, it will not show any symptom, but sometimes in immunocompromised patient or in case of the pregnant woman, it shows the symptoms. So it may be categorized as asymptomatic, acquired symptomatic, or congenital form. These all three forms may be seen in the human being. So first one is the congenital form, which is very important form. And if the woman is pregnant in third trimester, the severity will be more as compared to first and second trimester. Means when the fetal growth is increasing in that proportionate, the chances of the congenital form or abnormalities will be more. So here the congenital form can also be categorized or includes the following sign like retinochoroiditis, means inflammation in the eyes or retina or choroid layer of the eyes. And in fetus, it may develop the hydrocephalus condition or convulsion or intracerebral calcification. These are the some sign which you can observe in the congenital form. So most common is the ocular disease, or this inflammation of the choroid or retina is the retinochoroiditis form is a very common or most prevalent sign you can observe. Okay, sometimes it also infect the whole eye, but that is in rare cases. Here, this is the inactive chorioretinal scar. Scar formation is there due to the inflammation. So this is the picture of the retinal inflammation. Here in acquired symptomatic form, mainly it will develop the lymphadenitis, and mainly it affects the cervical lymph nodes, and it will lead to the fever, malaise, fatigue, muscle pain, sore throat, all type of the symptoms you can observe. And same time, you can also observe the encephalitis. And this condition is more in case of immunocompromised or immunosuppressed patient. In that patients, you can observe the symptoms of headache, disorientation, drowsiness, means all type of the sign, nervous sign you can observe. So this is the acquired symptomatic form. And these are the common symptoms you can observe in lymphadenitis. In case of 10 to 20% of the cases, you can observe the lymphadenitis. Already we have discussed the sign. And uveitis is also the inflammation of the eye. Okay, so you can also observe the uveitis in the immunosuppressed patient, just like in congenital form. So again, it is the neurological disease which is most common in the immunocompromised person. Already discussed. In case of animal, the abortion is the main sign. Abortion of the fetus is the main clinical sign which you can observe. And all type of clinical manifestations like fetal death, resorption, retention of the placenta, mummification, stillbirth, all types of gynecological issues is observed in the female animal. So these are the peculiar sign you can observe. Now you can diagnosis based on the various tests is there. First important is you can observe the increase in the high antibody titer by the comparison of the paired sera sample. And you can go for the various serological tests like agglutination test or ELISA, or one important test is there, that is Sabin-Feldman dye test. Very important test, and this is most considered as the most specific test for the diagnosis of the toxoplasma. And you can also go for the polymerase chain reaction by the amplification of the gene, or you can also demonstrate the tissue cyst which is present in the intermediate host by the histological examination. You can go for the isolation of the organism by the animal inoculation. you can inoculate the suspected sample in the mouse or rodents, and by the collecting of the peritoneal fluid, you can observe the organism. So this is the by the inoculation, you can proceed for the isolation of the organism. So histological examination already we discussed. So these are the all diagnostic tests. So Toxoplasma serological profile. This is very considered as the confirmatory test. It is not only the one test. It is the combination of the three tests. Like it includes the Sevenfeld-Divine dye test, or double sandwich ELISA, or differential agglutination test. So by this, or by the combination of this test, we can confirm the toxoplasmosis. So this is the TSP, Toxoplasma serological profile. This is already have discussed how we can harvest or isolate the organism. You can inject the suspected material in the peritoneal cavity of the rodent. After that, you can harvest the peritoneal fluid and you can observe the parasite under the microscope. Now you can go for the treatment by using the sulfonamide or pyrimethamine drugs. These are the sub drugs which are effective against the toxoplasmosis. So how you can prevent and control in case of human beings? So most importantly, the hand hygiene practice is very important while you are handling the cat or cat feces, or you are involved in the cleaning the cat litter of the domestic cat. So hand hygiene practice is very, very important, and proper cooking of washing the vegetables is very important. If you are cooking the food at 70 degrees Celsius, that is found effective by the destroying or inactivating the infected state, that is insist of the parasite. So this is very important. Or already the most important care is should be taken by the pregnant woman, because it can transmit the organism can transmit transplacentarily and leads to the abortion. So this are the some preventive and control measures for the toxoplasmosis. So this is all about the toxoplasmosis. If you have any doubt, any query, question, you can ask.